launch of FIP's Global Intelligence Report on the role of pharmacists in vaccination. My name is Gonçalo Souza Pinto. I'm lead for practice transformation at FIP, and I have the honor of co-moderating today's event with Professor Ian Bates, who is director of the Global Pharmaceutical Observatory at FIP. Today's panel will include some colleagues from our team who will be presenting some key findings from the study and the report that we're launching today. But we've also invited colleagues from other organizations and partners and close collaborators of FIP, other organizations that have led data-driven projects to inform vaccination strategies around the world. And that includes the World Health Organization, and we have Dr. Marta Gacic-Dobo from WHO. We have Katrina Buzani from the International Federation on Aging, and we have Lynn Morgan from the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA. And my colleagues that will be presenting today's report will include Farah Ahmad, Shirley Milianti, and Nisa Masita from the GPO, the Global Pharmaceutical Observatory. Just a few announcements and house rules before we move on with the webinar. As you may know, all FIP webinars are recorded and they are also live streamed on YouTube. So greetings to colleagues who will be watching also later on the recording. The recording will be available on our events.fip.org website. And should you have any questions, when we do hope you have questions and can place the questions on the Q&A box. Please do not use the chat box for your questions, otherwise they might get missed by the panel. So please use the Q&A tool. You're also welcome to provide any feedback you may have about this event or any other suggestions by email to webinars@fip.org. And we do invite you to become a member of FIP, an individual member, on the URL that you can see on the screen on our website, fip.org/membership_registration. We also would like to thank and acknowledge the unrestricted funding we received from GSK Vaccines to conduct this surveillance project on the role of pharmacists in vaccination that we have been conducting for a year now. Today's program will include an introduction by Professor Ian Bates and myself. We'll highlight the learning objectives and set the scene also to put this report into context. We will then launch the report and provide you an overview of the contents and key findings from this study and a presentation of the FIP Atlas. And then we will have 3 presentations by the organizations I mentioned earlier and the data-driven project that they lead to inform vaccination strategies as well. We'll then have a panel discussion. We invite you again to send in your questions and we will address them to the panel as well. And finally, we'll close the event with some closing remarks. So today's learning objectives include the launch of the report and to understand what the current situation is in terms of the role of pharmacists and how pharmacists contribute to vaccination, to improving and facilitating vaccine uptake and access. Also, as we understand that all strategies that aim to drive vaccine uptake amongst our communities need to be informed by solid data and evidence. So we have invited other organizations to present these other projects. And we'll also understand particularly what is the situation in terms of the regulatory and contractual frameworks that support or hinder the role of pharmacists and the implementation of pharmacy-based vaccination programs, but also the education and training for pharmacists to deliver these vaccination services and other findings. As you may know, today is the last day of this year's World Immunization Week, and we wanted to time the launch of this report during World Immunization Week. Because of our special relation with the World Health Organization, because we wanted to be part of the global effort and ensure that pharmacists are clearly part of the solution to improve the coverage of vaccination across all ages. This year's theme of the World Immunization Week is humanly possible, saving lives through immunization. And this year's campaign, led by the World Health Organization, advocates for governments worldwide to integrate vaccines into healthcare planning, adequately fund vaccination programs, accelerate vaccine accessibility research, and raise awareness of vaccination's impact, enabling universal health coverage, access to life and access to life-saving vaccines. This year is also a special year for the World Immunization Week because it's also celebrating the 50th anniversary of WHO's expanded immunization program. And this program is a major landmark by the WHO, and a recent study published by The Lancet reveals that global immunization efforts have saved an estimated 154 million lives, which is the equivalent of 6 lives every minute of every year over the past 50 years. The vast majority of these lives that were saved, 101 million, were those of infants, but the recent immunization agenda 2030 by the World Health Organization prioritizes and highlights the importance of vaccination across all ages throughout the life course. So it is now my pleasure to hand over the floor to Professor Ian Bates to provide an overview of the work of the Global Pharmaceutical Observatory and how this project of around the surveillance of pharmacists' role in vaccination fits within the GPO strategy. Ian, over to you.
Thank you, Gonzo. And an extended thanks to the whole FIP team who have worked very diligently, very hard on this significant and major report. Part of FIP's commitment to global pharmacy and global pharmacy leadership is to be a steward of data and to assist with advocacy of our members through data intelligence and ensuring that we adopt an evidence-led approach to policy making. Moving on this slide, we see that the GPO has been established in order to fulfill that function. The Global Pharmaceutical Observatory is still somewhat in its infancy, but is growing month by month and is now an engine room for data collation and data intelligence. And I'd like to thank the team once again for the hard work and commitment that they put into this particular data unit of FIP. Our next slide shows what the GPO remit is, what we are committed to do, which is to steward data. If we can advance the slide a little. Thank you, and more. It is to steward data and to create new data from that, to create intelligence and to create synthesis that's going to be helpful to all of our global partners and our members of FIP. Of course, our ultimate aim is to try and provide evidence of impact, and this report certainly does that. It's a collation of activities and data which, without doubt, shows the immense impact that the pharmacy workforce and pharmacy services worldwide has had and will continue to have into the future on this immunization and vaccination, public accessible services which are being provided. Gonzo very vividly illustrated that for us just a few moments ago. The real importance for today is that we need to use this data to understand what our vaccination needs are from a population point of view, but also from a service delivery and a regulatory point of view. This means that we can identify gaps and we can monitor trends, and we can use those trends to help move on, to help progress even further the immense work which is being done worldwide. Supporting policy formation better decision making, and embedding even further pharmaceutical services into community and population health. And finally, today we're going to see the impact of this report on best practice, how we can illustrate even further data-led insights into roles and responsibilities, and how we can unify and unite worldwide in order to provide global universal health coverage in this area of public health and immunization. Thank you again to the team for all the hard work you're doing on behalf of members and all the pharmacists worldwide who will benefit from study of this report and adopting the data-driven recommendations which we're going to produce. Thank you for allowing me those couple of minutes. I'm going to hand back now to our hosts.
Ian, excellent. And just before we move on with the presentation of the report, we would just like to set the scene by putting this report into context of the work that FIP has been conducting and delivering to our members for several years now. And just to provide you a little bit of an overview, the good pharmacy practice guideline that the World Health Organization and FIP jointly adopted in 2011 already included the services of pharmacists, including the administration of medicines, vaccines, and other injectable medications. It was defined already in that document as a key role of pharmacists. And 5 years later, we conducted our first report and survey-based report to provide an overview of the role of pharmacists in immunization. And we continue to do so and to provide our members with advocacy tools, with data, with guidelines on how to sharing experiences and best practices from other countries to mobilize and utilize pharmacists, not only to administer vaccines, to prescribe vaccines, but also to raise awareness and educate the communities and populations and patient groups about the importance of vaccination, especially in patients with risk conditions such as non-communicable diseases or pregnant individuals, other HCPs, and immunocompromised individuals, for example. We continued to do so, and in 2020, we conducted our second survey, which you can see there on the bigger picture on the slide, where we already identified a significant increase in the number of countries that were offering pharmacy-based vaccination and other roles. And we provided other advocacy tools, such as the call to action to governments to utilize pharmacists during the pandemic to deliver COVID-19 vaccinations as soon as they became available, which did happen. And this was an important development that we witnessed throughout 2021 as well. Other tools included handbook for pharmacists on vaccination and a toolkit on how pharmacists may contribute to building vaccine confidence and communicating vaccine value. In 2022, we issued our knowledge and skills guides describing the knowledge and the skills that pharmacists require to deliver vaccination services among various other publications. And last year, 2023, in addition to a regulatory self-assessment tool that can be used by professional regulators around the world to assess how the readiness of their regulations for pharmacists to take on these roles, we also issued a very important statement that was unanimously adopted by the FIP Council on the role of pharmacists in life course vaccination. And we published towards the end of the year a compilation of success stories of how pharmacists have contributed and expanded access to vaccination services through community pharmacies. At the very end of the year, we also launched a campaign that called Let's Talk About Vaccines, to initiate conversations with patients in our communities. And this year, although we are still not even halfway throughout the year, we have already published several new reports from inside boards and focus group meetings, in addition to a report on the benefits of vaccines beyond disease prevention. And just last week, we organized the FIP Global Vaccination Policy Development Summit in The Hague, in the Netherlands. And today, this brings us to the launch of our third surveillance report on the role of pharmacists in vaccination. So as you can see, FIP has kept a strong commitment to supporting vaccine uptake and improving vaccination coverage around the world through pharmacists. And just to highlight that in 2016, in our report, we identified 16 countries that had pharmacy-based vaccination at that time. 4 years later, that number had increased to 36 countries. And we also asked our member organizations at that time whether there were already plans or negotiations or advocacy efforts in order to introduce pharmacy-based vaccination in the countries that did not have it at that time. And in 2020, our member organizations told us that there were such movements and such efforts taking place, and it was expected that by 2025, 52 countries and territories would have pharmacy-based vaccination. And I invite you to keep this figure in the back of your minds, because you will be surprised that we have not yet reached 2025, and you will be pleasantly surprised by the figures that my colleagues are going to present from this year's study and survey. So it is now my great pleasure to launch this year's report, Leveraging Pharmacy to Deliver Live Course Vaccination, an FIP Global Intelligence Report. The report is available in 2 versions, an executive summary, which is openly accessible to all on the QR code and the URL that you see on your screens, and a more extended version of the report, which includes an analysis of the trends and the data, which is accessible by our member organizations only. In addition to these reports, this is complemented by an online atlas, the FIP Pharmacy-Based Vaccination Surveillance Atlas, which will allow this is openly accessible as well on the URL and the QR code that you see on the screen. You will be able to navigate and explore all the indicators or key indicators from this survey, and see what's the situation in each of the countries in terms of whether vaccination is available through pharmacies, which vaccines, the training and education that pharmacists receive, and the reimbursement or funding models that exist in each country, and so on. So it is now my great pleasure to introduce some of the colleagues that led the development of this work. Ms. Farah Akkad, FIP Data Integration Specialist, Dr. Shirley Melianti, FIP Data and Intelligence Specialist, and Ms. Nisa Matsita, FIP Project and Data Support Coordinator. So without further ado, Farah, the floor is yours. Thank you very much.
Thank you, Gonzo. Hello, everyone. So it's a pleasure to be with you today. Alongside my colleagues, Shirley and Nisa, we're pleased to give you an overview of this Global Intelligence Report, just prompting you to explore it following the event. I'm going to start with the question why this report? So the aim of our report is twofold. First, it seeks to provide updated data and comprehensive intelligence on the current landscape of pharmacist-led vaccination globally. By doing this, we aim to support ongoing advocacy for our members and policy-making efforts that are important, of course, in shaping effective health interventions. So throughout our extensive data collection and analysis, and facilitated by the contributions of our team and the member organizations, we've gathered key information and key data that not only highlights the growth in pharmacy-based vaccination, but it also identifies some of the ongoing challenges and opportunities for policy enhancement. This report is not just a collation and a collection of data, it's a call to action. It is a blueprint to empower pharmacists and enhance global public health strategies. So as you read the report, let's keep in mind our goal. immunization for all, which we believe is humanly possible. Next slide, please. I'd like to just take a moment to acknowledge the incredible team behind this report. So in addition to myself, Gonzo, Shirley, and Nisa, who you'll hear from soon, we've had important contributions from other authors and editors that you can see on the screen. Thank you, Mufan, Diala, Deborah, and Dalia for your support. In addition to the communications and marketing teams, a special thank you. And this report has also been reviewed by the CEO, Dr. Catherine Duggan, and the GPO Director, Professor Ian Bates, which both, of course, provided insights that shape the direction of the final report. And most importantly, of course, we must acknowledge our member organizations. So without your continuous support and without the data that you provide, the report would not be possible. And I know, although not all contributors could join us today, I know that some of you are here, and I want you to know that your work is greatly appreciated. So in our report, as you can see on the screen, we adopted a mixed methods approach to understand the evolving role of pharmacists in vaccination. We integrated data from various sources. So we had a total of 120 countries coming from our 2024 survey, previous surveys, and both primary sources such as the original research articles and governmental documents, in addition to secondary sources like review articles. So this rich data set allowed us to conduct a thorough data and trend analysis over time. If we go to the next slide, you'll see the map. This map visually represents the extensive coverage of our report, which includes, as I mentioned, a total of 120 countries and territories. If we go to the next slide. Shirley and I will now provide a quick overview of the content and the type of data available in the report. If we press next, in the first chapter of our report, we focus on the key role of pharmacists in vaccination awareness. This includes their involvement in educating the public, promoting vaccine uptake, and participating in national vaccination technical advisory groups. And if we go to the next slide, you'll see a bar chart. This bar chart basically presents the range of vaccination advocacy activities that pharmacists from across the globe participate in. As you can see, pharmacists' efforts in most countries are centered around providing information and advice, almost 79%, which is important for educating the public and enhancing vaccine uptake. Also, pharmacists are actively involved in both pharmacy-led and multidisciplinary vaccination campaigns, which shows their role in broader health initiatives. In addition to that, what I want to mention is basically often pharmacists, what we found from our findings is that pharmacists are usually underrepresented in the National Vaccination Technical Advisory Group. And what this tells us is basically we need promotion to include them throughout our enhanced stakeholder engagement and advocacy, and that this is key to leverage the expertise of pharmacists in shaping national vaccination strategies. If we go next, the next chapter covers the regulatory and contractual frameworks for pharmacy-based vaccination. This details the availability of pharmacy-based vaccination, so the authority of pharmacists to administer vaccines, prescribe vaccines, in addition to recent policy developments from across the globe. And if we go to the next slide, this map highlights the countries where pharmacy-based vaccination is available, and it highlights whether vaccines are administered by pharmacists, other healthcare professionals only, or both. So the visual representation, it helps us understand basically the spread and implementation of pharmacy-based vaccination globally, and it indicates where pharmacists are playing an active role in vaccination efforts. If we go to the next slide, based on our findings, as Gonzalo mentioned, we have 56 countries now with pharmacy-based vaccination, so marking an increase of 22 countries since 2020. And this represents a growth of 64.7%. Notably, pharmacists in 43 countries can administer vaccines. With a recent development, just 2 or 3 days ago, Finland has also joined this list, now allowing pharmacists to also administer vaccines. This significant update is not reflected in the report. It's a brand new information that we will also incorporate as part of our new versions and the Atlas as well. So we extend our congratulations to Finland and for all of the countries on the way for this progressive step. In 3 countries, pharmacists have full prescribing authority for all vaccines, and in 26 countries, as you can see on the screen, they can prescribe some vaccines. So what we mean by prescribing authority, it's allowing pharmacists to administer or dispense vaccines without a medical prescription and assess the vaccine eligibility for individuals. We know that 79 countries are currently, from the 79 countries, 37 countries are actively proposing developing policies aimed at enhancing pharmacists' authority. So we know that we have a significant trend towards expanding the role of pharmacists in vaccination. Next slide, please. This report also provides a preliminary overview of the reimbursement for pharmacy-based vaccination services. And by services here, we mean the administration of vaccines in pharmacy settings. A more detailed report will be released later in 2024 to go through the remuneration processes in details, but you'll find a summary in our current report. And if we go to the next slide, this chart on the slide, you can see that most countries and territories, pharmacy-based vaccination services are paid by the customer. However, our analysis identified 13 countries where the service is reimbursed by public health systems and 9 with reimbursement by private health systems. And in 10 countries, the service is provided at no cost to the patient or health system, so the cost is taken up by the pharmacy. If we go next. This section of the report, Vaccine Administration, details the variety of vaccines that pharmacists are authorized to administer, which reflect expanding the role of pharmacists in pharmacy-based vaccination. So from our findings, if we go to the next slide, the most widely administered vaccines by pharmacists is influenza, available in 30 countries, then COVID-19 vaccines available in 29 countries. Pharmacists in 14 to 20 countries can now administer a range of other vaccines, including Tdap, hepatitis, pneumococcal, HPV, herpes, meningococcal vaccines. And in addition to that, the emergence of the RSV vaccine in 8 countries is a notable development, which marks a significant expansion of the vaccination options available at pharmacies. The variations in vaccine administration can be seen in the report in full details, and in the summary tables that we include in the appendices. I will now hand it over to my colleague Shirley to continue to share further insights from our effort. Shirley, over to you.
Thank you very much, Farah. Hello, everyone. Let's now move on to the other section, which is about education and training section of the report. So if we go to the next slide, we'll see like a map showing where countries provide education and training to pharmacists. So we found an increase in countries training pharmacists to administer vaccine from 12 in 2016 to 64 now. So now 64 countries already provide, 64 countries reported that pharmacists were trained basically to administer the vaccine. And also 19 countries also now offer undergrad education in this area as well. This actually highlight the importance of comprehensive education, both in postgraduate training and also in undergrad level, to equip pharmacists in the necessary skills and knowledge in this area. So if we go to the next slide, looking at the breakdown of countries where pharmacists are authorized to administer vaccine and where they are not, you will see in the bar chart on the right side show that 100% of countries where pharmacists are authorized to administer vaccine, they have their pharmacists trained to administer the vaccine. And on the left side, you will see even in the countries where pharmacists lack authority for administering vaccine, 17 countries actually reported that they provided training to pharmacists. This actually shows a proactive approach to prepare pharmacists for future involvement in the vaccination efforts. We can move to the next section, which is about the vaccination records. And if we go to the next slide, we will see a bar chart. And we will see in here, while only a minority of countries provide access to vaccination records, there has been an increase in countries where pharmacists can access some or all vaccination record of patients since 2016, which is the blue bar chart. This increase is actually very important because it will enable pharmacists to identify individuals who may require vaccination according to national guidelines or booster doses. And this will allow a tailored advice and optimized vaccine delivery by pharmacists. So we now move to the next part of the report, which is about the limitations. So we know that there are a lot of positive trends. In our report, we also highlight some limitations regarding the development of pharmacists' role in vaccination. So if we go to the next slide, we will see a little bit of comparison about non-pharmacy-based vaccination setting and a pharmacy-based vaccination setting. In the non-pharmacy-based vaccination settings, it is good to note that in this country, we have a good improvement where previously in 2020, in 2020, 81% reported a lack of confidence, and this year only 33% reported a lack of confidence, so which is a good improvement. And when we look at the pharmacy-based vaccination settings, we can see there is a need basically for enhanced pharmacist training, and also a need for an increased public awareness, and also pharmacist role in this area. So the next slide will show you as well like a common challenges in both scenario, whether it is in a pharmacy-based vaccination or in non-pharmacy-based vaccination setting. And the common challenges in here is basically the support from the regulatory and also from the other healthcare professionals. And also there are some economic barriers as well. This limitation actually highlight a need for advocacy efforts to stakeholders on the benefits of involving pharmacists in vaccination efforts, and also to establish a productive interprofessional collaboration. So this is about the limitation. And if we go to the next slide, which is the last section in the report, where we highlight about public satisfaction. So previously, we mentioned that the role of public in enhancing pharmacist role is important. So in this report, we also highlight a little bit about the public satisfaction rates with pharmacy-based vaccination services. So pilot projects in several countries have demonstrated a high patient satisfaction. They mentioned this is related to convenience and also professionalism, which is a key factor. Despite challenges such as resistance from the healthcare professionals mentioning in some regions, and also patients' preference, our report indicates a strong satisfaction and willingness to utilize pharmacy-based vaccination services. And this is a signal basically for potential for further expansion in this area. So in summary, in our report, we mentioned that pharmacists have a pivotal role in global vaccination efforts. And as we navigate the evolving healthcare landscape, addressing challenges and leveraging opportunities is important to ensure equitable access to quality vaccination services. And we would like to encourage you all to look at our report in detail, because we provide more details there, which can be learning opportunities for our colleagues and also for our member organization. And my colleagues Farah already provide the executive summary and the full report link, and also the atlas in the chat box as well. Now I would like to pass the floor to my colleague Nisa Masita to provide the overview of the pharmacy-based vaccination surveillance atlas as another output of our project. Nisa, the floor is yours.
Greetings everyone. In this video, I will give you a tutorial on how to navigate through the pharmacy-based vaccination surveillance atlas. The homepage of this atlas provides you with trends for key indicators of pharmacy-based vaccination globally from 2016 to date, which was sourced from the report. Right at the top, you'll find a link to access the full report. On the right-hand side, hit play to view the trends. Below this button, you'll find filters to customize your view. Select specific regions or income level according to your preferences. To view the list of countries from these data points, right-click on the bar of your interest, select Drill Through, and click on List of Countries. Click here to go back. Below the filters, there are several tabs offering detailed insights into pharmacy-based vaccination at the country level, comparisons between countries, as well as other key indicators such as the number of countries where pharmacists can administer or prescribe vaccines, and for which vaccines they can administer or prescribe, reimbursement for vaccine administration, and vaccination training. Now, let's delve into the country profile. To access information on pharmacy-based vaccination for individual countries, simply click on the country of your interest. For example, right-click on Australia, select Drill Through and Country Profile. You'll be directed to this page, giving you detailed information on pharmacy-based vaccination in Australia. Click here to go back. To view this information in a tabular format, click on this tab and scroll down. Right-click on any row. For example, Switzerland, select Drill Through and Country Profile, and then you have it. To compare pharmacy-based vaccination between countries, click on this tab. Use the filters on the right-hand side to customize your view. Hold down the Control key to select multiple options within each filter. For instance, filter by region of the Americas and high income. This tells you how pharmacy-based vaccinations are implemented differently within these countries. On the Administration and Prescribing Authority page, you can extract information on the number of countries authorizing pharmacists to administer or prescribe vaccines. Select the options from these filters and hover over the map or table to view the list of countries. To find details on which vaccines pharmacists can administer or prescribe, click on this tab. Filter by specific vaccines, for example, COVID-19, and choose between administration, prescribing, or both. On the reimbursement page, you can delve into the information on how pharmacists are reimbursed for vaccine administration. Hover over the map to observe changes in reimbursement options over the years by regions. Use the tabular format to see changes in specific countries. The final indicator is vaccination training. Find out if pharmacists receive vaccination training and at what career stages. Hover over the country or the map to see details such as whether training is mandatory, if pharmacists need to renew their certification, and how long the certificate is valid for. That concludes the overview of this atlas. For access to the full report, please click the link provided here. Should you have any inquiries regarding this atlas, please don't hesitate to reach out via email to observatory@fip.org. Thank you very much. Over back to you, Gonzo.
Thank you very much, team, for this excellent presentation of the reports, the two versions, and also the atlas. As I think that our attendees, our audience today, got really excited about the possibilities and the wealth of data that is available in both these publications and the online atlas. And our CEO unfortunately could not join us today live, but she didn't want to miss the opportunity of sending a message in relation to this new publication. So Dr. Catherine Duggan sent the following message, which you will allow me to read. This collective intelligence supports not only the evolving role of pharmacists, but also our advocacy efforts, empowering our members to push for meaningful policy changes that recognize and utilize pharmacists as primary providers of vaccinations, thereby enhancing public health measures across the globe. So thank you very much, Catherine, for this message. And we now come to the part where we will also learn about the amazing data-driven projects that other organizations are conducting and leading to support and inform policy formation and vaccination strategies around the world. And we will start with the World Health Organization's immunization data portal and how it supports the implementation of WHO's Immunization Agenda 2030. And for that, we have the pleasure of having as a speaker at today's event, Dr. Marta Gacic-Dobo, who is lead for global monitoring at the Immunization, Vaccines and Biologicals Department of the World Health Organization. Marta, we are delighted to have you as a speaker today. Our colleagues will copy Marta's biography onto the chat box so you can read more about her role in WHO. And Marta, the floor is yours. Thank you very much.
Thank you very much. Good morning, afternoon, and evening, everyone. And it's my great pleasure to participate in this important event. And I would like to congratulate the great and very comprehensive report you are just launching now. So let me talk a little bit about the WHO immunization portal, which is actually a component of a broader WHO immunization information system. This is a common platform to collect, manage, analyze, and disseminate key immunization data. It has three key components. The data collection part, which is either through the annual survey or through a most frequent provisional data, which is being pushed to WHO from the regional offices or directly from the countries on a regular basis. The data storage, which is a centralized storage for different data sets on a standardized and easily linkable format in accordance with the broader WHO Health Data Hub standards. And finally, the data dissemination, which is the WHO immunization data portal, but also numerous more specific dashboards and visualizations, and also allows other portals to link to the WHO data and disseminate this information. So if you can please just move to the next slide. But I would just like to spend a few moments on the data collection process, which is a joint process between WHO and UNICEF, and it started more than 2 decades ago. It's a global level. Sorry, if you can just go back for a moment. Thank you very much. So this is really a data collection process to collect data for the immunization community, and it is very well synchronized between WHO and UNICEF and also our key partners on immunization. It is revised every 2 years to make sure that it's agile and reflect the latest policy and strategy needs, And also it is done in a collaboration with ministries of health, with the 3 level of the 2 organizations, and with our key partners. And another important point, this data is then provided by the ministries of health. So this is an official report to WHO. And in 2021, we moved into the electronic web-based system with this process. And if you can move to the next slide. So the data goes directly into our data mart, as I showed you in my previous slide. And from there, it is disseminated through our immunization data portal. In the immunization data portal, you can see different, you can access different data sets, the raw data, some of the calculated indicators, and also many visuals and reports and analytics which are available. Just to highlight some of our key data sets, we have data on vaccine preventable disease cases and incidents. We also have data on subnational and national coverages as it is reported by countries, but also the assessment done jointly by WHO and UNICEF on the coverage estimates. You can also find here the national immunization schedules and introduction of new vaccines, and also different immunization program indicators and also financing indicators on immunization. And if you can move to the next slide, please. So the data use. So this WISE project contributes widely into the different reports, including the Immunization Agenda 2030. It really is the basic information source for monitor and assess immunization trends. It contributes to the Sustainable Development Goals. We have an vaccination indicator from SDGs, and this is how we monitor that indicator. Provides input for the national immunization coverage estimates, for immunization, vaccine preventable disease burden data, and also support publications and official reports and presentations. And also it's an input for many articles and peer-reviewed articles on immunization. And if you can please move to the next slide. So allow me to remind you about Immunization Agenda 2030, strategy with a vision for the decade aligned with the SDG goals for a world where everyone, everywhere, at every age fully benefits from vaccines for a good health and well-being. It has 3 strategic goals: reduce morbidity and mortality, increase equitable access for use of new and existing vaccines, and ensure good health for everyone by strengthening primary health care. The strategic framework has 7 strategic priorities, and it has already been mentioned in the beginning of this seminar. One of the strategic priority is the life course vaccination. It also has 4 principles, 4 main principles: people-centered, country-owned, partnership-based, and finally, but very importantly for this presentation, data-guided. And if you can please move to the next slide. This immunization strategy comes together with a monitoring and evaluation framework and accountability framework. And for this monitoring and evaluation framework, for the 3 strategic areas, we have 7 impact goal indicators. And also for the 7 strategic areas, 21 strategic priority objectives and 15 global indicators, but also the indicators are quite flexible for the regions and the countries to fulfill their own strategies and to use the ones which are the best to measure the strategies. And if you can just please move to the next slide. And then to really be able to track the status of these strategies, the WISE is also linked to the immunization scorecards, where one can really see all the goals and the strategic priority areas, and also indicate if the goals and strategic priority areas are on track or off track with different color codings. And here one can also look at the indicators both at the global level different regional aggregations such as WH and UNICEF regions, all work income status, and also country profiles. And I put in the slide here the link where you can look at those scorecards. And then if you can move to the next, my final slide, please. So really, in a summary, just to say that robust, complete, and high-quality data is key to track and report progress towards the achievement of Immunization Agenda 2030 goals and strategic objectives. But what is more important is to interpret the results and assess why indicators are off track and identify and advocate for priority actions. Use the priorities to develop and implement operational plans and allocate resources accordingly. And this really needs to be done in all levels. So it has a very importance at the global level, but also in the different regions and the national level as well. So with that, I thank you very much. And I give back the floor to Consul.
Thank you very much, Marta, for this amazing presentation of this incredibly valuable source of data and information to inform vaccination strategies and policies. We will now move on to a presentation by the International Federation on Aging on the IFA Global Atlas on Adult Vaccination. And the presentation will provide an overview of the objectives, key findings, and how the Atlas supports advocacy efforts. We will have the presentation delivered by our colleague, Ms. Katrina Bouzanis, Director of Policy and Advocacy at IFA. Katrina oversees IFA initiatives in adult vaccination, such as strengthening national immunization technical advisory groups, so NITAGs, improving policy and awareness of vaccine-preventable diseases for older adults, and developing advocacy strategies with the goal of improving uptake and access to adult vaccination. So thank you very much for joining the event today. Katrina, the floor is yours. Thank you.
Thank you so much, and thank you so much to the organizers for the kind invitation to present on what IFA is doing in this area. And so I'm very pleased to be sharing some of the work through the Global Atlas on Adult Vaccination that's supporting the use of data and evidence in shaping vaccination strategies. So first, I'll just start off by introducing a little bit about the International Federation on Aging, or IFA. So IFA is an international non-governmental organization with a unique membership base comprising of government, other NGOs, academics, industry, and individuals in over 80 countries. And over the last 45 years, the IFA has become known as a leading and innovative organization that works across disciplines and sectors towards common goals that improve the lives of older people. So IFA's mission is to drive the agenda of the world's aging populations so every older person can live their life to the fullest in a society that respects their past, present, and future contributions. So IFA has kind of a long-standing history of work in improving adult vaccination and vaccination for older adults. So improving rates of vaccination globally is a priority of the IFA, really through the lens of healthy aging. And so the IFA, across almost a decade and through what we call our Vaccines for Life program, has worked alongside other organizations to address barriers to improve adult vaccination rates. And so this program is really framed by three intentions, which is to be kind of a reliable source of information, evidence, and good practice on the link between adult vaccination and healthy aging. The second intention is to mobilize knowledge, experts, and expertise through the creation and use of innovative platforms and channels of communication. And lastly, the third intention is to influence and help shape policy related to adult vaccination and at-risk groups through capacity building at both the national and international level. So I'll just kind of, present kind of briefly a little bit of background. And so as all of us kind of know on the line here, and as was mentioned in the beginning of the webinar, vaccines are really key to fostering healthy aging across the life course and maintaining function well into later life. And so this is sort of within the context of rapid population aging, with increasing rates of non-communicable diseases, and as well as kind of the waning of the immune system that occurs with aging, which is known as immunosenescence. And so, for all these reasons, we have currently kind of an unprecedented number of at-risk populations that, have the potential to be protected through vaccination. And so just a couple of kind of the ongoing and emerging challenges which led IFA to kind of thinking about the need for a repository of evidence like the Global Atlas on adult vaccination. And so, currently we're seeing lots of overburdened health systems, particularly in a post-pandemic landscape. I think this is a trend seen around the world and really speaks to the need for health systems to be kind of reformed towards prevention. Additionally, we're seeing kind of an unprecedented vaccine pipeline. So there has never been more vaccines available to older adults than there is currently. And I'll note that there's, many more that are currently coming down the pipeline, which really speaks to the need to focus on older adults as a key population that requires kind of improved vaccination coverage and vaccination rates. So additionally, we're seeing, lots of gaps in routine immunization. So this is, quite a concerning trend globally. We're seeing declining rates of vaccination uptake across disease areas and actually across all ages. There's been sort of attention to a renewed focus on pediatric populations through initiatives like the Big Catch Up, but we're not necessarily seeing the same focus for older adults. And so there's really a need for continued attention on these populations to ensure that they're receiving routine immunizations. Thirdly, we're kind of seeing continued vaccine hesitancy, as well as, maybe more better characterized as vaccine fatigue, which is, of course, contributing likely to some of these declining vaccination rates. And then lastly, seeing kind of a lack of data and evidence-based decision-making when it comes to the funding of vaccinations, what sort of vaccinations get included in national immunization plans and programs, when we look at NITAG recommendations and different programs that are concerned with the vaccination of older people. So all of these kind of global challenges led the IFA to thinking about creating a platform that enables champions, influencers, and even those just looking to learn about vaccination to easily kind of view the knowledge generated on adult vaccination and understand the key findings at a glance, as well as the gaps. And so the Global Atlas on adult vaccination is really meant to be kind of a one-stop repository of evidence on adult vaccination. And this is really meant to be used for advocacy. So I'll note that this is guided, we're very happy to have a global advisory committee, including experts, from the International Pharmaceutical Federation, from the World Federation of Public Health Associations, World Heart Federation, International Council of Nurses, and many others that are guiding the implementation of this global atlas. And really the goal is to build a community that kind of respects independent work, provides a source for lessons learned, good practice, as well as knowledge translation to action on, improving vaccination for older adults. And so really this atlas, it spans countries, it spans networks and policy priorities. I'll talk a little bit more about the policy priorities coming up. And it's really aims to benchmark evidence by country and enhance advocacy at a country level for looking at vaccinations that are really specific to older adults. So this just gives a little bit of a flavor of what the Global Atlas will look like. So this is kind of an initiative that is currently on the Vaccines for Life platform, currently on our website right now, called the Shingles Atlas for Adult Vaccination, which really is, just focused on shingles vaccination. But the Global Atlas will certainly integrate this work and certainly be a similar visual and be a similar platform in terms of an interactive map, which you can see kind of in the top left corner. You're able to kind of change the different categories and the different criteria that you're looking at, as well as hover over the different countries to view information that is specific to the countries that have been included. And then additionally, you have a little bit of a more substantial report that details kind of all of the information so far. And so the Global Atlas will look kind of similar, obviously being kind of much more robust in terms of the amount of information, and also the amount of vaccinations that are included there. So I just wanted to share a little bit on, what kind of information will be included in the Global Atlas and what kind of policy and different topics we'll be looking at in terms of the data that is being showcased. And so really, firstly, we'll be looking at policies. And so this is really asking the question, are older adults included in national immunization plans and programs? And vice versa, is vaccination included in national aged care plans? And similarly, we also have kind of an indicator there on NITAGs looking at, do NITAGs include expertise on aging or adult vaccination? Next, we're looking at funding. So is vaccination publicly funded? And also looking a little bit on the budgets for vaccination and different public health agendas. Next, we're looking at programs. So is there accessible information on vaccination targeted towards older adults? Is vaccination administrators, have they been expanded? So this will include things like, are pharmacists included as vaccine administrators? Are healthcare professionals really trained and informed? So this, also harkens back to what was presented by colleagues earlier in the session. And then next, we're sort of looking at performance. So are there goals and targets, for the reduction of vaccine preventable diseases, particularly specific to older adult populations? And are there mechanisms to collect age disaggregated data on vaccination coverage and uptake? Next, we're looking at equity. So, does the National Immunization Plan provide specific focus on certain subgroups of older adults that we know are more at risk to vaccine preventable diseases? So that's, that may be people with chronic respiratory diseases, people with diabetes, different things like that. We're also included kind of a specific category on long-term care settings, as we know that this is, a particularly important policy priority. So is vaccination included and available to long-term care residents? Is it included in kind of broader long-term strategies and plans? And then lastly, just a category on civil society, looking at whether, civil society organizations in the countries and, national peak organizations are actually involved in promoting adult vaccination and also advocating for more comprehensive vaccination policy. So all of this kind of criteria and information and data will be collated into a country level report card. And each of the categories will be given a grading, and you can see kind of an example on the slide here. So green obviously indicates kind of a well-developed policy environment. Orange or yellow kind of indicates a little bit more of a partially developed status. And red is, either the information was not available or it's quite underdeveloped. And so, we'll be developing, a country level report card for each of the countries that will be included in the Atlas, which really allows you to kind of take a quick scan to see how a country is doing on all of these different fronts. So lastly, just kind of in conclusion and to finish off, I want to share a little bit about how the GAV is really going to be supporting advocacy efforts. And so this really aims to be a source for the latest evidence on adult vaccination generated by IFA, but also by different partners that are involved and by, the countries themselves. It's really meant to highlight gaps in policies, programs, funding, et cetera, and really be used as a tool to advocate and demonstrate the areas that need the most pressing kind of advocacy efforts. So at the end of the day, we hope that this will be a tool that really mobilizes country level action, because we know that is sort of the area where policies are created and where policy change happens. And at the end of the day, kind of the aim is to really improve adult vaccination uptake rates and ensure that older adults are protected from vaccine preventable diseases. Oh, sorry, my apologies, forgot to change the slide there. But that is kind of my conclusion. So thanks so much for your time and attention. And I'll pass the floor back over to you, Gonzalo.
Thank you so much, Katrina. This is a very exciting project, and I'm sure that it will be immensely valuable to inform vaccination strategies and policies by many stakeholders around the world, governments, associations, civil society organizations. So thank you very much for IFA's leadership in developing this project. And lastly, but certainly not least, we will have a presentation by the International Federation of Pharmaceutical Manufacturers and Associations, IFPMA, on the life course immunization country landscape report. Excuse me. Dr. Lynn Morgan will be presenting on the scope, some of the key findings, and implications for policy and practice of the findings in this report. So Lynn is head of public affairs for influenza and pandemic preparedness at IFPMA, and she's passionate about the value of flu vaccination for at-risk people, especially older adults, and a strong advocate for achieving evidence-based policies through partnerships that advance shared immunization goals. It is our absolute pleasure to have Lynn on the panel today. And the floor is yours, Lynn. Thank you very much.
Wonderful. Thank you very much, Gonzalo. I should point out, so I'm here representing IFPMA. I actually work for Sanofi in their public affairs department. So if I can have control of the slides, I'll go to the next one. Happy World Immunization Week, everybody. I'm absolutely delighted to be here. But it's been very interesting, actually, the talk so far. I've enjoyed it very much. Thank you, FIP, for inviting me, and congratulations on the launch of a very exciting new report. And bravo as well for the Atlas. It looks like a fantastic open access resource, and I look forward to going and having a look at that. So yeah, bravo for that. Fantastic. So I've been involved with IFPMA now for about 10 years, and it's an organisation which throughout that time has advocated for innovation and also for life course immunisation. So they've been really behind the whole movement about life course for quite some time now. And because for a long time, vaccination has been perceived as being just for children, and that's what it's generally associated with. But in reality, we know that for many countries, we're actually entering a new era. And we heard from Farah earlier on about the offer of vaccines for throughout the life course, be it being able to prevent HPV infection in adolescents, meningococcal infection, being able to prevent pertussis in newborn babies through immunizing pregnant women. Or then if we look at older people, the fact that we now have tailored vaccines that have been designed for them in order to prevent them from suffering the complications of influenza, ability to prevent pneumococcal infection, shingles, and now very recently the doors opening to being able to prevent RSV as well. So it really is a very exciting time. What's the next one? So here's the question, and we heard it from Marta earlier on. Can we achieve a world where everyone everywhere at every age fully benefits from vaccines for good health and well-being? And as Marta explained, this is the framing that was given in the Immunization Agenda 2030 for life course immunization. It's a laudable aspiration, and it's one that I think we can all rally behind. So IFPMA commissioned this landscaping report to collect evidence focused on specific life course immunization policies and geographies. So they looked at across the 5 WHO regions to compare available data sets and case studies before and during the COVID pandemic in order to assess the quality of evidence for policy and practice change. So the following slides over the next few minutes have been prepared to socialise that report and focus on some of those key findings. Immunisation has been overwhelmingly successful, no further comment on that. But when we look at a life course approach to immunisation, in fact, only a few countries such as the UK, the US and Australia have actually implemented concretely a life course immunisation strategy at a national level. So that leads us to go on and say, okay, there's some gaps here, and there's some potential solutions that we need to think about. I'm going to skip on this slide for in the interest of time and take us to what the report found as being 4 key pillars in terms of being able to close that gap. So one pillar is policy, and they clearly pointed out the fact that there are massive differences in approaches per country, which again is understandable given the fact that the report was looking across the world. There's a lack of data, and I think that today's session is all about being able to close that gap, and we're already hearing about new sources of data, which will be extremely helpful in closing that gap. But that creates a kind of a vicious circle whereby the lack of data takes us on to issues around funding. The funding for adult vaccination is clearly inadequate. We understand that. But again, this vicious cycle means that because there isn't enough data, the funding is not there because the need to vaccinate against older adults against diseases is not valued somehow. So there's a definite need to document the high value and low cost of vaccination in a broader, more holistic framework. When we look at some of the program aspects, and I'll call out here clearly to community pharmacies as a delivery mechanism for vaccination, and that the clear finding from the report that has to be promoted further, and fantastic to see the amazing progression that's already being made. And that needs to be doubled down on and pulled through even more. And then last but not least, this point on performance and the question of coverage data. Very variable and certainly not high enough. So the report went into a little bit more detail around what that coverage actually looks like in practice. And it turns out that for many adult vaccine preventable diseases, there's little or no data. I guess flu is probably the adult vaccine that has been around for the longest, and we're seeing very diverse coverage rates, certainly well below pediatric immunization rates, and huge variability even in healthcare workers. And rates going from 15% through to 63%. So clearly, an issue here in that whole mindset of healthcare workers being immunized against a kind of a fairly basic adult disease of influenza. Staying with the point around coverage. So how do we improve that coverage? What do we do about it? Well, the report findings pointed to 3 main areas of focus. The first one being around access, and clearly a role for the pharmacy community on the webinar today. This role has been expanded in many high and middle income countries, but a lot remains to be done in less resource settings. So we hope that some of the progress that we're seeing in the numbers of countries embracing pharmacy-based immunization are also including some of those low resource settings. In the second bucket, when we look at investment, this is a clear point, and I think Katrina raised it in her presentation around our ability to value older individuals as they are a key part of our society and the value that they bring, often in an informal setting, but certainly not to be neglected in any way. And then last but not least, this question around confidence and how confidence can be built, and the role of pharmacists in doing that, the interaction that community-based pharmacists can have with individuals. And I want to call out a piece of work that FIP did earlier this year and made available in on their website. And these are 3 very nice webinars that are there to help pharmacists have that conversation around vaccine confidence, because we saw earlier on that there's a training around helping pharmacists being confident in vaccinating, but they also have to be confident about talking about vaccines with the people who come into their pharmacies, having that conversation. It can be quite complex. So these are 3 webinars I'd invite you to take the time to go and have a look at. They're 12 minutes long, and one of them is by Katie O'Brien from the IVB at World Health Organization, and one of them is by FIP's very own Gonzalo. So I'd recommend you to go along and have a look at those. They're extremely useful, very well done indeed. In terms of focus groups, clearly pregnant women was an area that came out as being an area of focus that needs to be addressed, particularly in the continent of Africa, but also awareness among health professionals. That certainly is an area that needed to be improved according to the report findings. So if we look at the 3 overarching priorities that were identified, there's demonstrate the societal value, sustainability, and accessibility. I'm going to just move on to my last slide now in the interest of time. I see we're at 1:15, and get to the okay, now what should be done now? So the report concluded on 3 major areas that could be addressed under the topics of the exchange of best practice, including experts in policymaking and documentation and value. In terms of best practice, there's the whole notion of building a body of evidence, a body of knowledge, and we've heard about that in the presentations today, which is fabulous. I think we're moving along from when this report was published a couple of years ago. Document and communicate on those success stories, the successful implementation of community-based immunization, and spread those best practices across countries. In terms of including experts in policy making, well, certainly the last point that's listed here is working with professional organizations to expand on the role of nurses and in pharmacists. And then, of course, that last pillar around documentation and value. So I won't spend any more time on that. I think we've understood today on the importance of the data that have been generated. There is a plethora of data being generated, and if we keep feeding into that and building into it, then I think it bodes well for the future of life course immunization, as we want it all to look like, just like the immunization agenda statement called for. And with that, I'll close. Thank you.
Thank you so much, Lynn. This is a fantastic report. Again, a very valuable tool that includes amazingly well-researched data and conclusions and information that can definitely inform policy formation and provides valuable recommendations. So thank you very much for presenting this to us today. So we come to the panel discussion, and we understand we're a little bit over time, but we think that it was absolutely valuable and interesting and exciting to learn about these projects and the new FIP report as well. So we'll and I see that my colleagues have been responding to some of the questions on the Q&A box. So I will encourage you to share any further questions you may have on the Q&A box. And in the meantime, I will stop sharing the slides and invite our panelists today to come on video and maybe just start with a couple of questions from our side. And one of them, and I will ask all 3 panelists to address it briefly, and maybe starting with Martha. We know that data suggests that there's still a long way to go in terms of achieving equity in vaccination across all ages, across the life course, and particularly for older adults. How would you suggest that data can be used to advocate and achieve policy change towards higher vaccination coverage rates among adults?
Thank you for the question. And I think, as we already heard during the different presentations, one is what is very, very important is to understand the behavior and social drivers of immunization, to really understand how we can generate demand. So I think we really need to probably collect more data on that, do more studies on that, and then make sure that the data is well analyzed and widely distributed. So that can definitely help to address some of the vaccine hesitancies, and also to make sure that people understand and they are really aware about the benefits of vaccination and about the reducing of morbidity and mortality and increasing the quality of life of older age. And I would also like to say that we are celebrating the 50 years of EPI program, but we need to remember also that when the EPI program started, it was then really the basic vaccines were against the childhood disease. And so that was really the major focus. And that's where we have a very good platform. But for adult vaccination, the platform is very different, and even the data collection is very different. And we don't really have good systems, even in the most developed countries, to track the older people and to really collect the data. I also heard the lack of this very simple tool, which is with us for 50 years, the home-based records. So something like as simple as that, to make sure that every single individual have access to their immunization over the life course. And that can also help, because with such a simple tool, then surveys can be done, better understanding can be done, and also cost-effectiveness studies to see the benefits of the vaccines on that population as well. Thank you. Thank
you very much. And Katrina, I think that this question speaks directly to the purpose of the GAV. So what would be your comments on that? How can we actually use data and activate the data in that observatory to drive policymaking around vaccination strategies that really place the focus on adult vaccination as well, to address that equity issue across the ages, across all ages?
Yeah, well, thank you so much for the question. And, I echo as well, Marta's comments around it's important to kind of understand those behavioral and social drivers, particularly in instances where vaccination is available and people are just, not getting them. But I think, in a lot of cases, there's, a huge lack of understanding of what is the burden of disease for some of these vaccine preventable diseases in older adults, and kind of, outside of just mortality or hospitalizations, how does it actually affect function, in older adults? And, that kind of speaks to what Lynn was saying, if we don't have that data, how do we properly kind of make that investment from governments in order to make these vaccines available? So I think there's, that's, maybe a complicated piece to tackle, particularly relating to what, Marta was saying around kind of the lack of monitoring and things like that. But I think there's certainly other, data that is being collected, or, other, pieces that are being generated by, by yourselves, by FIP, and also by other partners that are more, tools on how to advocate for adult vaccination, how to make that connection to vaccination and healthy aging, or how to make the connection between vaccination and, let's say, cardiovascular disease or chronic respiratory diseases or things like that, can certainly be kind of leveraged in the absence of some of these maybe more robust sources of data, which of course we're advocating for that as well. And I think, the GAV really aims to showcase we don't have this age disaggregated data, and we actually need that to make really good decisions. And so that's, part of, compiling this evidence, actually showing we have gaps here and here and here in terms of the actual data, but also in terms of, the vaccine coverage and the vaccine uptake.
Great, thank you so much. And this links very well to your work and the IFA's work on NITAGs and the composition of NITAGs, and ensuring that the perspectives of older adults and gerontologists are actually part of the decision-making around vaccination programs and schedules. Lynn, we know that WHO has set a target of 75% for flu vaccination, and this was already years ago. And we know that the European Commission and European organizations have also adopted that target. But still, most countries actually, or very few countries, I should say, actually meet that target. And this applies, and there's an equity issue, I think, with this target in itself, which is quite different in terms of for adult immunization and for childhood immunization programs. What comments would you have on that? Why is it that so few countries actually meet that target, and why is it so much lower than for childhood vaccination?
Thanks for the question, Gonzalo. So yeah, I mean, I'd be delighted if more countries could actually meet that 75% mark. It's a tough one. It's a tough one on how you reach people, how you bring them in regularly it's an annual vaccination, so that's a tough one. There have been various studies done on how we can improve this. Why is it so different from childhood vaccination? I think it's historical. I mean, Marta touched on that already with the whole EPI program being there initially for, originally for childhood vaccination, getting children past that 1 year mark and then getting them past the 5 year mark was like absolutely the ultimate priority, as we're seeing demographies changing, as we're seeing how older people live in communities with high rates of transmission. Then we have to rethink what those targets need to be. To come back to how we actually improve that those rates of coverage, there have been some very nice pieces of work done. There was one published back in 21, which comes particularly to mind by Castellanos and colleagues, who categorized they looked at the 4 high-performing flu VCR countries in the world and looked at all the things that they did and tried to map them out to see if there was like a secret recipe. So there isn't, clearly. Every country has to find its own way. But there were 5 common pillars, and 2 of those pillars are very relevant for the talk today. 2 of them, and I'm going to read them out. One of them is facilitated access to vaccination, so everything that's happening through PBI. And the second one is about healthcare provider accountability and engagement. Again, massive role for pharmacists. So no single recipe, but pharmacists are up there in a large majority of the solutions that can be brought to a country level to improve those vaccination coverage rates.
Thank you so much, Lynn. We do have a question from a colleague online, Nabil Atif, and the question is, for the countries that have no data available in terms of the models, the model inputs to make decisions based on CEA and modeling studies, what does the panel suggest? When there is no data, how can policies be informed? Tough one, tough question. Marta, may I start with you, maybe?
Thank you. Yes, so one of the recommendations, there is no data in a certain countries. This is where we can profit from data for some other countries. So probably one of the options is to look at the data which is available already from other studies from a country with a similar epidemiology, and as an initial start, use that data to inform the policies as well. And then the other thing is to set up certain studies and collect some data, which is of course take changes, but that take times, but that is also something very important to do, because people do like to have their own data as well, also to then eventually strengthen the policy and to make sure that the decisions were right.
Thank you so much. And as we approach the end of our session today, I would just like maybe invite the 3 of you just to provide a 1-minute message in terms of how pharmacists can be mobilized to drive vaccination coverage, and why it's still a major challenge in some countries to actually recognize this role that pharmacists can play. There's opposition from other stakeholders or from governments or policymakers, sometimes other health professions. So what would be your summary message to our audience today? And we'll start with Katrina. Thank you very much.
Yeah, sure. Yeah, I think, pharmacists have an incredibly powerful role to play. And I think the amazing thing is that, thinking back to that data, Gonzalo, that you presented in the beginning, you have a number of amazing case studies to really demonstrate, the role that pharmacists can play in terms of getting vaccinations to people, supporting their communities, having conversations about vaccination. And so I think there's really a number of really positive examples of how this is, integrating pharmacists as vaccine administrators has really made a huge difference in terms of increasing vaccine availability to people. And I think particularly this is the case for older adults where, as we know, that infrastructure is not as established of where to go to get a vaccine. So my advice would be to look at, those amazing kind of places where they've had the success of integrating pharmacists, and, to take some lessons and good practice from there. And so I think, that's incredible to see the number of pharmacists that are being included, and hopefully that can just continue to build.
Wonderful. Thank you so much. Lynn, what would be your final takeaway message?
So I'd say that the margin for improvement is massive. There's still a lot to be done. And really, there is room for everybody. We need all the levers that we can use to get to a better place in life course immunization. Nurses, pharmacists, physicians, yeah, everybody can bring their own stone to the cairn, if you like. So yeah, room for everybody. And my second point would be have that conversation. Look at those FIP webinars; they're fantastic. Once you've watched them, you'll feel ready to go out there, have those conversations with whomever, and really get us to a better place on life course immunizations. Pharmacists hold that power in their hands. It's fantastic. So good luck.
Thank you so much. And finally, Marta, what would be your final takeaway message? Thank you.
Finally, just to echo what Catherine and Lynn already said, but I think pharmacists really have the power. It's also very nice to see that from 60 now over 65 countries, they can actually deliver the vaccine, which is already great. But pharmacists are in contact with the general population all the time, especially when they are sick. So promoting vaccination, promoting the prevention at that point, I think that can be very, very powerful. So if we all go with the same messages, especially pharmacists, that will definitely help a lot.
Wonderful. Thank you so much. I would also like to thank my colleagues here today who have done an extraordinary job in developing this study and this report and the atlas as well. Thank you very much for such a great team effort. And to everyone who has attended today's webinar and for staying with us. And apologies, we're a couple of minutes over time. But a special word of thanks also to our three panelists today, Marta, Katrina, Lynn, for sharing such valuable experiences and data-based projects to inform policies on vaccination and vaccination strategies across the life course. It's been a pleasure, and I truly thank you on behalf of FIP for contributing to this event. Have a great rest of your day everywhere. Goodbye. Thank you.